And good afternoon, good morning, good evening, whatever time it may be in your location. My name is Woody Collins, and this is another episode of Talking About Congo. In today's episode, we're going to be talking about some work that Congo Helping Hands is just agreed to team with health officials in a health zone and provide a number of different interventions to families with children. So we'll get into that. Uh, this is a little different from what we did in 2018 when we went over and because of the Camino Sapo uh, uprising, the people and families were really uh, suffering from food insecurity, basically having nothing to eat or not enough to eat. We went over and provided food to families. We bought corn, grind that corn up into cornmeal. We also provided cassava flour. We also provided palm oil, salt, uh, and different things for them to be able to cook their staple meals and provide the staple for their daily meals and things. So this time we are working with the health zone. Uh, as you may know, Congo is divided up into 500 and some health zones, and each health zone has health clinics that they supervise, and each health center somewhere between 1,000 to 10,000 potentially, uh, or maybe 5,000 people in the health in a clinic that's the clinic is responsible for. So basically, that is about a small village. So each village would have a health clinic. So we have chosen, well, our partners in the Congo have chosen 8 different health clinics that we're going to do this innovation intervention into and helping the mothers and with young children who are in need of both medical assistance and deriving from food, the like of food. So in this situation, you have young children who are underweight, probably at the point of being their growth being stunted, very maybe even some of them have uh, um, extended bellies that switches from kwashiko and also endemia. And so what we're going to be doing is providing not only food, uh, the same thing, corn, cassava, and stuff, but we're also going to be providing special food for the children, which is a fortified food that will allow the children to get the a super nutritious uh, uh, meal. It's some of it is made from peanuts and things like that, so they will get the proteins to rebuild their bodies faster than eating the normal food. In addition to that, we are going to be providing the health centers with medicines. Not only medicines to treat them for, uh, you know, their current sickness or their sickness derived from malnutrition. That could also entail uh, worming medicine, diarrhea medicine. They may have need antibiotics. They may have malaria, all types of different stuff. So we're going to be providing the medicines that will help them not only treat the malnutrition, but also treat their medical needs. Where in the past we only concentrated on providing food to the family and did not get involved with the health officials to see what was the needs of the children. So we will be buying medicines for the health centers to so that they can provide care to those young children who are suffering and things. So we think this is going to be a much better approach to it, where most of the traditional food programs come in. They come in and provide food, but they do not look at what the needs of the children are. They think that the food will make them whole, and when in fact the food is only one portion of it. And once they start getting food, they still have some underlying conditions that may have developed, as I said, like malaria, like worms. They may need antibiotics, different stuff that they may need to overcome some of the underlying ailments that has developed as a result of their weakened body. So this we're gonna see how this works out, but on theory, it sounds much better, and that we are going to reach some of the vulnerable children where we did not, look at the vulnerable children last time. As a matter of fact, when we made food distribution, the the mothers came in and got the food and went back to their houses. We did not see that many children because they were left at the house. But this time we're using the health clinics and the health clinics who already know who are the sick kids, who are the ones that's really suffering. And the health centers are not in a position to provide food. They there to assist medically. And a lot of times they can only prescribe what should what a family should have, but they do not give out medicine. The family has to buy their own medicine, and so that is another problem. Is in the Congo, you go to the doctor or you go to a health clinic, they'll tell you what's wrong with you and you need to go buy so and so. But if you're poor, don't have food, and the last thing you're going to be doing is trying to buy medicine uh, when when you don't have food to eat. So I think this is a more holistic approach that should help out a lot more families and children. So we'll see how this works out. We just approved of it today, and it will start next week when our partners over in the Congo start gathering the food, seeing what specific items of medicine that the health center is going to want to buy and to treat, and what quantities and stuff like that. So we will see. I say we'll start next week. The process will start, but probably it'll be another week before we actually purchase uh, the partners over there on the ground purchase medicine, because we had to send the money over there, and it takes probably close to a week. Uh, there's a good average on the money actually being in hand, where somebody can go out and do it, but they can go place orders for stuff, but they cannot pick it up until they pay for it. So that's what we're going to be doing, and so we'll be uh, giving you updates on that, uh, and also taking a look at what some of the underlying problems are, because it's just one of those situations where food insecurity and the lack of eating has caused other health problems for the kids. Thank you all for stopping by today. We will talk to you tomorrow. And please, if you like this, like, subscribe, and share this. And also leave your comments as to what you think about. And thank you so much again. And we will talk with you later, uh, sometime tomorrow. And you can always catch these telecasts on YouTube, Facebook, and on uh, both my personal profile, and also the Congo Helping Hands YouTube and Facebook. Thank you so much, and we'll talk to you later.